Hey there. I'm excited to tell you about MedX Prime and pharmacogenetic testing. I am Wendy Place. I'm a holistic healthcare practitioner and a certified trainer with MedX Prime. And I want to just take a few minutes and go over what pharmacogenetic testing is, how it's going to benefit you and your family, and how can you participate or be involved in this. But before I do that, I want to tell you just a quick little story about how I got involved with MedX Prime in the first place. It's probably not a normal fit, seeing that I'm an herbalist. But I was on the way to the beach with a friend, and I said, "How are things going with your naturopath?" And she says, "Oh, it's awful. My A1C is out of control. I feel really bad. I don't know what's going on. I wasted all this money on supplements." So as she was talking, I'm putting two and two together, and I said, "You know what? I think you have MTHFR gene mutation." And she says, "What's that?" And I said, "I don't know, but there's a Facebook group that I'm part of with some really smart people, and there's a thread about it. Let me find it." So I found it and I read it all to her. And she says, "Absolutely, all of that applies to me." So she went home, did a bunch of research, changed up her protocol, and she's naturally been able to bring her A1C back under her blood sugar under normal range. She's gotten all off all her meds except for one. And the catalyst to all this positive change was understanding this gene variant that she had. And that just got me so excited about learning more about this genetic testing. Well, what is pharmacogenetic testing? Basically, what it is it's personalized medicine. So it's going to help your provider know which medications are going to work best for you, what are not going to work best for you, what might cause harmful side effects, and even catastrophic results. So it's very personalized to what your body can metabolize and how fast your body metabolizes meds. There's no more guesswork and there's no more trial and error. No, think about what your doctor has to do. They kind of have to do a one size fits all approach to people with their best knowledge, of course, behind them. So they're going to say this generally is the right med for this condition. This generally is the right dosage. But they really are not sure until after you've had either after it's not worked or after you've had an adverse drug reaction. So you can imagine if you went into your provider, or let's say you even had an emergency and had to go into the ER. Let's say it's like a gallbladder attack or something like that. You're going to have this test with you to show the provider, show the anesthesiologist what meds are specifically going to be processed and metabolized well at which dosage for your body, which is, you can see how that can be life saving. A provider is going to have way more compliance with their patient because a lot of people don't want to take meds because of the side effects. So if they can see that their body is going to be able to metabolize this specific med well, there's going to be way more compliance. And then also it reduces liability for the physician. And why is that? Well, because adverse drug reactions are the fourth leading cause of death. There are 128,000 Americans that die each year as a result of taking prescribed medications. Think about that. That's huge. I don't know if you've ever had an adverse drug reaction. I have. I've woken up in the middle of surgery before. I've also, after I had my twins, I was incredibly ill for about 10 hours afterwards. And thankfully, those two things were just very unpleasant. They weren't life altering, of course, or catastrophic. But you wouldn't know that you're going to have this reaction prior to having surgery unless you had this test done. 91% of patients have at least one gene variant that would prompt a doctor to recommend a change of what they're going to prescribe. 91%. So why is this not standard practice? Well, it costs $1,500. Most people would have to pay out of pocket and can't afford that. The reason I got involved with MedX Prime is because they do not pass the cost on to the patient. There are a couple exceptions to that, but most of the time, you can have this test done without any personal cost. If your insurance pays 50 cents, that's fine. You are not on the hook for the remaining balance. It's one of the only, I think it is the only company, at least at the time that I'm doing this recording, that does not pass the cost on to the patient. And then it improves um, time for everybody. Think if you're on the wrong med or the wrong dosage, how many times you have to go back to your doctor. So hours of time are saved both for the patient as well as for the doctor. And here are some organizations that have adopted the PGX test or pharmacogenetic testing. St. Jude's is testing all their patients. Mayo Clinic, Johns Hopkins. This is definitely where we're moving, that this is the standard of care. So here's a sample report. The first page is specific to the referring doctor. So in this case, the doctor is recommending this test for pain management. So the front page is saying, consider alternatives. Here are the dose recommendations. So you might be a rapid metabolizer, slow metabolizer. Proceed with caution, or normal response expected. Of course, you're wanting to take things that are in the green. Then the next few pages are also specific to that referring doctor. So in this case, pain management. So it's telling you when to consider an alternative, what kind of dosage. It's telling you why. It's telling your genotype and your phenotype. So again, you can do some research. And then it's going on to give a report based on the meds that you currently are on or the ones that the doctor is considering putting you on. If it's in gray, it just means that there's not enough testing done yet, but they're always adding more drugs to the specific test. And so you can always go back and look at those later. Then the next few pages are going to be drug to food interaction, drug to drug interaction, drug to alcohol interaction. So really important information if you are on multiple meds to know this information. This is crucial. This is, again, why so many people have adverse drug reaction is just the drug to drug or the drug to alcohol interactions. Then it goes into different specialties. So the next maybe 20 pages are specialties. All the meds that are fully researched will be on this report under the specialty that would be recommending it. So you have anesthesiology, cardiology, you have all your psych meds, you have oncology. So all the different specialties will be listed with all the meds that are, again, these are specific to your body, how you're going to metabolize these. And then the last couple pages is your specific gene report. So this is where you get to become a researcher and look at your genotype and look at your phenotype and really understand. I remember my friend that got herself well did it naturally. She actually was hoping to go off most of her meds, but she still needed this information to be able to change her protocol with her doctor and get herself well. This is a very simple test. It's just a cheek swab that's done in the doctor's office. It's sent out to the lab. The lab processes it all and does all the insurance billing. So it's really very little added work to the doctor, just the cheek swab, and then you go back in to go over your report. So how do you get involved? How does this affect you personally? Well, hopefully you can see that this is a test everybody should have done. We never know when an emergency is going to come up. We never know when we're going to need this to give to our doctor. And because it has all the specialties, maybe you just see an allergist. That's all you're seeing right now. But you might eventually need a different specialty and you'll have this report with you. And you probably have thought of some family members that maybe are on multiple meds. This actually absolutely can be life-saving for them. Now, maybe you're in a situation like I am where you have several clients that you thought of would really benefit from this test, or maybe you're a nurse in a clinic and you can think, oh my goodness, this clinic really could use this. Well, then you can become a referring partner. You don't have to get involved with Med-X Prime or become certified, but there's just a small monetary thank you for referring partners or referring patients to me. So that might be another level that you want to get involved with. But that's what I was going to do until I learned more about Admira Labs. And I saw that there was the gut biome test that they're coming out with, the full oncology genetic test. And there's so many things that Admira is doing that patients are needing to get on board with, that I went ahead and got certified and partnered with Med-X Prime. And so by getting certified, obviously the compensation is greater. So if that's of interest to you, let's talk and see if that's a good fit for you. So the next step is go to medixprime.com/Wendy Place, read a little bit more, watch a couple of videos on there, and then give me a call. Text me, call me, email me so that we can make sure that you are in the situation with your doctor to get this test done, and we'll just get you taken care of at that point. Thank you so much for taking the time to learn about pharmacogenetic testing, and together, let's save some lives.